I'm Vanessa, and today I'm going to be doing an IV. I'm at the nurse's station, and I see that the doctor has an order for Miss Booker to get Lasix 20 milligrams and 1 gram of Rosifin IV. So I'm going to have to give her an IV. And I'm looking at her history. She has no history of CHL, renal disease, AV shunt, CVA, no mastectomy. Lab values look fine. Vital signs okay. No pending procedures. So I'm going to give her an IV, and I already set up my table. I have it draped. I cleaned it off, sanitized it, draped it, and I have my extension, my IV. This is a 24 gauge. My tourniquet, my tape, my flush, and I use my transparent and mix it up. So this gonna be an imaginary transparent. And I have my tape hanging over here. And I'm going to go to the room. I also look at the chart before I go in. She has no allergies, so I'm in the patient room. I'm gonna perform hand hygiene. How you doing, Miss Booger? Can you state your name and date of birth? Okay, everything matches. Do you have any allergies? No. Okay. I was looking at your orders, and the doctor has put in an order for you to get 20 milligrams of Lasix and Rosifin, 1 gram IV. So I'm going to have to give you an IV. Have you had an IV before? You have? All right. Any complications? No? Okay. I'm going to check the jugular veins. Okay. And then skin turgle. I don't see any swelling. All right. Now I'm gonna listen to your lung sounds. Okay. Lung sounds good. So now I'm not sure if I asked you, do you have any allergies? Okay. So I'm gonna perform hand hygiene. Let's see, can we find a vein? And I also already put something under the arm, so just in case we have a mess. You know you. I'm gonna tie this. I'm gonna tie it tight, but not too tight. I'm gonna make sure I can feel the pulse. Get an alcohol pad, wipe down. So I'm trying to find a vein. And I see one. So since I found a good one, I'm gonna release this, the tourniquet, for a second. And then I'm going to get my extension and my flush. Take the top off that. Get the air bubble out of the flush. I'm gonna connect it. I'm gonna unclamp this. Take this top off, and I need to keep this top sterile. So I'm not gonna touch it or let anything touch it. So I'm gonna flush this line. Okay. And I'm gonna lay the tip inside that bolt to keep it sterile. And I'm going to put on some gloves. Before I put on gloves, I'm gonna tie this back. Then I'll put on some gloves. Get an alcohol pad and wash off the area. Now I go a little wider than what I'm gonna use. Get my needle. Put the bevel up. I'm gonna pull the skin back. There's some hole just in case the veins try to roll. Go in at a 15-degree angle. I'm gonna put the bevel in on top of the vein. I got the bevel in. I'm watching for a flashback, so I have one, so I know that I'm in the vein. I'm gonna go in a fourth more. Then I'm gonna push the catheter in. And before I take the needle out, I'm gonna release the tourniquet. And just above where the catheter ends, I'm gonna apply pressure and still stabilizing the catheter. I'm gonna pull the needle out, drops container, and I'm gonna connect the extension. While I connect the extension, I still supposed to have pressure on the vein. Now I'm going to, I have it in, I'm gonna release the pressure. And I'm gonna secure it with a piece of tape. Crisscross. Leaving where it's connecting open. I'm gonna open this and flush. Do you feel any coolness? All right, aspirate. All right, then I'm gonna clamp this off. Put my transparent dressing on there. And then I'll put it on there and then peel it off around the edges. Pressing down as I pull off. It's secure, and then I will use the label that comes with it and have my initial date and time on there. I get that and put it to the side. And I'm going to remove the flush. I'm going to tape it out the way. Okay. Now I have that taped down and it's clamped off. I will get everything, put everything back where it goes. So put the bed at its lowest position. Make sure the patient is covered up, and I'm gonna take my gloves off. Perform hand hygiene. And I forgot to mention, before I put the IV in, I would have the patient kind of like tip the hand or either hang it off the side of the bed so I can get a good angle. And then I'll go back and document, and my documentation will read, have a date and time, intracranial number 24 gauge inserted into left hand, time 1, attempt using a tourniquet connected to saline lock extension tubing, blood aspirated and flushed with 3 milliliters normal saline, no signs and symptoms, perforation, secured catheter hood with clear IV tape, dress site with TSM and secured tubing with clear IV tape. Patient tolerate procedure without pain and anxiety. Instruct the patient to let staff know if IV site becomes painful, red, swollen, or has drainage. Signed, BK. Okay. Also, after I would assess the area to make sure, there's no swelling after I put the IV in. Now I'm back at the nurse's station, and I see that the doctor has put in an order for Lasix 20 milligrams and Rocephin 1 gram. So I'm going to go get those meds ready. You can see. Okay. First, we need Lasix 20 milligrams. So I got my Lasix, and I'll check the date on it. It's good. I'm going to go ahead on and open that. And then I'm going to get an alcohol pad and wash it off so it'll be dry while I gather the rest of the meds. My normal saline. Check the expiration date on that, and it's good. And I need Rocephin 1 gram. This the Rocephin. So I'm going to draw up my Lasix. I'm going to draw up a half a milliliter of air. Put it in. And then I'm going to draw up a half a milliliter. Okay. Scoop my top back up. And I'm going to put it in this little bag that I have. And I labeled it Lasix 20 milligrams so I can know what it is. Put this back. Now that I have my meds, before I would have gathered my meds, I would perform hand hygiene. Now I'm going to go to my patient's room. Okay, I'm in the room. Hi, how you doing? I'm Vanessa. I'm going to be your nurse today, and I have some medications for you that need to be, it's going to be IV. Can you state your name and date of birth? Okay, everything matches. All right. Do you have any allergies? No? Okay, the doctor has ordered you Lasix and Rocephin to be administered through your IV. So I let the bed up to my level. Perform hand hygiene. And my gloves. Okay, first we have Lasix 20 milligrams. This is my Lasix for Miss Booger at 0900. Okay, I'm gonna take that off. First, I will unclamp the port, unclamp it. Wash the tip of it off real good and the sides. And I will flush it. Now I'm gonna flush it. Are you okay? All right. I got that flush. Take that off. And I'll wash it off. And I'm going to administer the LASIK. And I'm going to do it slowly. A fourth of each 15 seconds. Alright, got that in. I'll flush it again. And I will flush it the same way that I put in the LASIK and doses. Okay, got that. Flushed it. And I'll wipe it off. Clamp it back. Okay. Now I'm going to hang my normal saline. I'm going to turn this on and prime it. I'm over the garbage can. And it's good. I'm going to close it back off. And the receiver is going to be piggyback. I'm going to hang this. This is the receiver. I'm going to prime it, turn it on, prime it. I'm not going to let it run out. I'm going to let it get at the end and stop it so I won't waste it down the body. It's running, so close it back off. Here. I'm going to clean off the spot where I'm going to put where the port at, where I'm going to connect them together. Have those on, and then the pump will be running at 100 milliliters per hour, 25 drops per minute. So I'm going to test that. turn the pump on and watch to make sure it's running correctly. And it is. So I'm going to close those back off for a second. Now I'm going to connect it to the IV. I'm going to begin by unclamping it. I'm going to wash it off, the sides and all. I'm going to flush. I'm going to flush it. And after I flush it, I'll take it off, wash it again. And then I'm going to connect them. Before I connect it, I have to take off the sterile tip, the cap, and then I can connect them. And I turn the pump on, turn the valve on, make sure it's running. And it's running. And then I will tape some of the line on the arm to hold it in place. Okay, this should take about an hour. If you feel any pain or tingling, anything abnormal or swelling, let me know. But I'll assess the skin to make sure I don't see any swelling. And I don't, so that's fine. Then I'll clean my mess up, put everything back where it go, let the bed down in the door's position, and take off my gloves. Perform hand hygiene. Now it's been a couple of days, and I'm looking at her orders, and I see that the doctor has put in an order to DC the IV. So I'm looking to make sure she don't have any orders, procedures, or labs, none. So it's okay. I assume that it's okay for me to take out the IV. So I'm gonna go to get what I need. I got gauze, alcohol pad, and I'll use this tape and my flush. I don't need the flush. I need the gauze, alcohol pad, and tape. So I'm in the patient room. Hey, how you doing? I'm Vanessa. I'm going to be your nurse today. Can you state your name and date of birth? Okay, everything matches. Okay. I was looking at your orders, and I see that the doctor had put in an order to DC your IV. So I'm going to take that out. I'm going to stop the pump. Let's stop. Perform hand hygiene. Put on some gloves. Let the bed is at my level. Let the bed up. And then I'm going to begin by taking this tape off first. And then I'm going to disconnect this. Hang it on the pole. And I get an alcohol pad, rub it around to wet my edges. First, I'm going to take off this bottom piece of tape. And while I'm taking off the tape, I'll be making sure that I secure the IV, the cap. Pulling the skin to make sure I don't pull the skin. then I'm going to take off the transparent dressing. I don't have one, so I'm gonna peel and go around, getting the edges, putting the skin as I get it. We got that off. Dispose of that. And then before I do that, I would have clamped off this after I disconnect the IV. Turn the IV off. Okay, that'll loose. Tape on. I'm getting my gauze, put it at the tip, pull my IV out, gonna assess the catheter and put it in the starch container and hold pressure for 30 seconds. Then I'm gonna look at it to make sure there's no bleeding. And I also will assess for swelling. No swelling. The bleeding has stopped. So I'll get a clean gauze and put it on there. And then I'll tape it, put a piece of tape on it. Everything. Put the bed back in its lowest position. Make sure she covered up, collar bell and reach. And I get everything out the way that I use. And then with this saline, I'll pour it in the garbage. Pour it down the sink. And then I take all this down and get it out the way, out the room. And I take off my gloves. Hand hygiene, and I'll go back, go to the desk and go to the cab and document, and my documentation will read, have the date and time, order received to DC IV catheter, intricate number 24 gauge, removed from left hand, catheter tip intact, no redness, swelling, tenderness, nor drainage at site, pressure applied to site for 30 seconds, bleeding stopped, and sterile 2x2 gauze dressing applied and secured with clear tape. Patient tolerated procedure without pain and anxiety. Instructed patient to notify staff if bleeding or discomfort occurs. Signed, B. And this concludes my video.